So doctors, please, you can see that this is very important. So let's go to the causal conditions. And you realize that the Medical Council always states something that the list is not exhaustive. The list is not exhaustive. So what are they actually saying? Remember, we talked about primary headaches and life-threatening headaches. So the primary headaches you need to master will be migraine headaches. So if I were you, I'll write this down that look, I need to master migraine headache. I need to master chronic daily headache with medication overuse. So medication overuse headache. And those in MedCognito, you will realize that if you go to your neurology portal, neurology portal, we've done a whole lecture series on all these things for you. Number 2, you need to know secondary headache. So you need to know headaches associated with vascular disorders like severe arterial hypertension, headaches associated with non-vascular disorders like patients who develop intracranial infection. And examples of intracranial infections can be meningitis, encephalitis, cerebral abscess. And then you must also learn headaches which are associated with systemic viral infection, headache as a result of carbon monoxide exposure. So doctors, please, you can see that this is very important. This is very critical, very, very critical. So I want to know, doctors, if you were supposed to learn for this topic, now you realize that the Medical Council has broken everything down for you. First, make sure that you've mastered migraine headache. And whenever you are mastering any topic, I always say that there are 6 things you need to know: clinical features, differential diagnosis, investigations, management, complications, and indications for referral. Number 1. Number 2, what are the investigations I need to do? Do I even need to do any investigations at all? Number 3, how do I manage a patient with migraine headaches? Number 4, are there any complications? Number 5, what are the investigations I need to do? And number 6, when do I refer a patient with suspected migraine headache to a neurologist? You do the same for medication overuse. You do the same for patients with, severe arterial hypertension. You do the same for patients with meningitis. You realize that with meningitis, you need to get your lumbar puncture, you need to give your antibiotics, you need to isolate the patient, you need to even know, when do I give prophylaxis to patients who have been exposed to this particular patient with meningitis, right? You need to know if somebody has carbon monoxide poisoning, how will they present? Doctors, please, I've just given you so much information right now. If you are following me, just type following.